In the Impassion 130 study, we did see that the benefit for the addition of atezolizumab to nab-paclitaxel was really restricted to patients with PD-L1 positivity. And in this study, PD-L1 positivity was defined by using the SP142 antibody on the Ventana platform. And positivity was defined as having any staining on immune cells that was greater than 1%. And so, generally speaking, when we're now selecting patients to be treated with atezolizumab, we have been using the SP142 antibody to select patients. However, this is challenging in practice because many of us don't have availability of SP142 testing. So one big question has arisen is, could we just use a different antibody to test for PD-L1, and would it equally predict benefit to atezolizumab? And so one very good analysis that was done retrospectively from the Impassion 130 study was they actually went back and took all the tumors from the patients and stained them all for three at least different PD-L1 antibodies. So they stained it for PD-L1 using SP142 or SP263 or 22C3, and they really looked to see if PD-L1 positivity with each of these antibodies correlated with survival. And they also looked to see what the concordance was between staining with these antibodies. And what they found was that of the patients who are in this biomarker subgroup, about 40% of patients tested in the biomarker subgroup were positive for PD-L1 by SP142. But when you looked at 22C3, it was 81% of patients who were PD-L1 positive. And for SP263, it was 75% of patients. And so in essence, what you end up seeing is that of the patients who are 22C3 positive, almost all of them are SP142 positive. So it's only about 1% of patients who test for 22C3 that are positive that are not going to be SP142 positive. And very similar with SP263. And so you can see that the concordance between these antibodies is actually quite poor. So the concordance between SP142 and 22C3 is about 64%, and the concordance between SP142 and SP263 is also similar, about 69%. So again, very poorly concordant. And so, as you would expect, given the poor concordance, we also see that these antibodies, such as 22C3 and SP263, are not as good as SP142 in predicting overall survival outcomes. And they actually tried to do this analysis looking at various cutoffs for the different antibodies. So, 22C3 traditionally has different ways of scoring. So, you can use a combined positive score, or what we call a CPS assay, or you could even potentially analyze it using the IC scoring system, as was used with SP142. And no matter which way they analyze the antibodies with the different scoring systems, still SP142 using the IC scoring system performed best in terms of predicting overall survival. So I think the bottom line from all these concordance assays is that it does not seem that the different antibodies are concordant, and it does seem that SP142 with the IC scoring system seems to be the best at predicting who's going to benefit from atezolizumab. And so I think given this in our practice, we have turned to getting SP142 testing on our patients in order to predict who should get atezolizumab. So that in our case, at our lab, we actually have to send out to a central lab to get SP142 tested because internally our hospital doesn't have that assay validated. And I think this is a challenge at many institutions, where in other cancers, people are using different antibodies. And so not all hospitals have SP142 validated. And so it has required a send out at many institutions. I think given the poor concordance between the various antibodies and seeing that 22C3 and SP263 did not perform as well as SP142 in predicting atezolizumab benefit, I do think that we should use SP142 testing when selecting patients for benefit from atezolizumab, because I do think it's possible if you send a different assay, such as sending out 22C3, you might select a patient that, even though they're PD-L1 positive by that assay, may not actually benefit from atezolizumab therapy. And so you may be over treating patients with atezolizumab and potentially exposing some patients to toxicity.